In the AMALFI trial, we were looking at the question as to whether a screening for undiagnosed atrial fibrillation might be a worthwhile routine activity. We all know that atrial fibrillation is a huge burden. There's an awful lot of it around, and it brings with it a lot of complications. Stroke is well understood, but increasingly we recognise heart failure and other complications with AF. And if we can find AF early, then we could potentially start preventative treatments sooner and hopefully stop those complications from happening. But the problem is, we don't always know that people have got AF, and so perhaps we should go looking for it more routinely. In AMALFI, we randomised 5,000 participants to receive a patch monitor, an ECG 14-day continuous patch monitor in the post, or just to continue with usual care. And we followed them for 2.5 years to see just how much AF was diagnosed and recorded in the primary care records. Overall, we saw about a 30% increase in the rate of AF diagnosis in the group who received the patch. And along with that was a parallel increase in the use of anticoagulation, suggesting that earlier detection does get people onto these treatments sooner. Because AMALFI was relatively modest in its size, we aren't able to demonstrate a clear effect on outcomes such as stroke. But what we could show was that this approach to screening, using a remote system that didn't involve any visits to healthcare providers, participants could do it simply in the comfort of their own home, was very acceptable and potentially an approach that could be scaled up to a nationwide screening program if it was thought to be appropriate. We're continuing to follow the patients and we'll come back, I hope, in a couple of years' time with longer term results from this important study.